I'm Dr. Daniel Braby, otolaryngologist specializing in rhinology in western Montana at Rocky Mountain Ear, Nose, and Throat. And I'll be presenting a case where I use Chitogel during endoscopic sinus surgery. The patient is a 50-year-old female with triad asthma or Samter's triad that has failed systemic and topical corticosteroids and antibiotic treatment. She's presented with airway obstruction, anosmia, and significant asthma flaring. Pan-mucosal thickening was observed on her CT scan post-medical therapy. Patient required full bilateral frontoethmoidectomies with sphenoidotomies, removal of disease, and maxillary antrostomies, also turbinate reduction for resolution of her disease. Placement of the gel is performed at the completion of surgery, initially into the frontal sinuses bilaterally. The middle turbinates have been medialized and secured with a chromic suture with the transeptal technique, and then gel is placed within the frontal sinuses using a curved applicator, allowing the frontal recess and frontal sinus to fill nicely with the gel itself. After completion of bilateral gel placement, the catheter is changed to the straight applicator and the sphenoid sinus is filled, running this into the ethmoid. I prefer to get a complete filling of all of the sinonasal mucosal surfaces and skull base, and then bring this forward or anteriorly into the ethmoid, meeting the frontal sinus gel, and then put this into the maxillary sinus, which essentially with the straight applicator you can do by just continuing to fill the ethmoid. It spills nicely into the maxillary sinus. Following completion of filling of the ethmoid and adequate filling into the maxillary sinus, gel is continued to be applied to the anterior junction between the middle turbinate and lateral nasal wall, leaving a good airway inferiorly, but completing the gel placement over any bleeding surface. Initial video at 4 weeks post-op with the patient rinsing with mometasone reveals some mild mucosal thickening over the maxillary and anterior ethmoid. The frontal recess is nice and patent. The skull base is healing well. There's a little bit of crusting posteriorly toward the sphenoid, but the maxillary sinus mucosa is clearing very nicely. 4 weeks on the right side reveals a little crusting over the inferior turbinate. The middle meatus is widely patent, middle turbinate nicely medialized. A little bit of, again, mild mucosal thickening over the lamina papricia, but the skull base is healing nice. The sphenoid sinus mucosa is settling down very nicely. The frontal recess inferiorly is clearing well up into the frontal sinus, which is not completely visualized in this video. The maxillary sinus also clearing well. The next series is 4 months post-operatively, initially on the left side. Nice maxillary antrostomy. The middle meatus is widely patent. Sphenoid and skull base are healing well. Almost no residual mucosal thickening over the lamina papricia. The introitus to the frontal sinus is widely patent, and the frontal sinus is healed very nicely. Septum is healed well. Crusting is resolved from the turbinates. Switching to the right side, again, the middle meatus widely patent. Maxillary sinus mucosa has healed well. The sphenoid sinus is coming into view and is essentially normal except for a trace amount of mucosal thickening. Skull base is very clear, working into the frontal introitus. The frontal sinus is widely patent, maintained its surgical patency very well, and mucosa there has healed very nicely. Patient is now 6 months post-op and has maintained an excellent result. Her airway is excellent. Her asthma has completely resolved. She's off all inhalers, not requiring systemic steroids, and just doing mometasone rinses twice daily, and very happy with her result.